Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to Dr. Ozello Sports Medicine Report. Today I'm going to cover the upper body stress fracture. Stress fractures can occur anywhere in the body. I already did a video on the stress fracture, but that was basically when I spoke about the lower extremity. So today I'm going to speak more about a stress fracture in the upper body. Stress fractures can occur in any bone in the body. A stress fracture occurs when there is too much training and not enough recuperation. A stress fracture is the textbook overuse injury. I'm going to say that again. A stress fracture is the textbook overuse injury. Bones are constantly remodeling so that they become stronger where more stress is placed. The problem is when you do too much training and do not give yourself sufficient rest between training sessions, the bone does not have enough time to strengthen in that area. And that is when a stress fracture occurs. A stress fracture is a partial fracture of a bone as a result of repetitive sub-maximal loading. Stress fractures are caused by rhythmic and repeated application of mechanical subthreshold loading. It is an overuse injury that generally heals in 6 to 8 weeks if recognized early and treated correctly. An acute stress fracture is rarely seen on an X-ray. Radiographic results become positive when the fracture callus becomes visible. A stress fracture is usually seen on a bone scan, CT scan, or on an MRI. The upper body stress fracture usually occurs in the rib cage in sports such as rowing, baseball, and golf. In rowing sports, the rib stress fracture makes up approximately 10% of all rowing injuries and primarily affects ribs number 5 through 9. In baseball, the first rib is usually where the injury occurs. This is a throwing injury which occurs especially among baseball pitchers due to repetition. Most first rib stress fractures occur at a location called a subclavian groove. This is between the attachments of the scalenus anterior and the scalenus medius muscles. This is the thinnest and weakest part of the first rib. A first rib stress fracture is usually a throwing injury, especially among baseball pitchers. The contributing factors of an upper body stress fracture include rapid increases in training, volume, intensity, distance, and or pace without adequate time for adaptation, lack of rest and recovery days, a failure to follow intense training days with easy ones for recovery, energy deficiency through diet, low calorie intake based on the amount of exercise performed, and low vitamin D levels. Again, low vitamin D levels are a contributing factor to a rib stress fracture. Symptoms of a rib stress fracture are generally present as a vague, ill-defined discomfort before progressing to a painful stress fracture. It has an insidious onset. It can become a sharp stabbing pain located over the affected rib, usually beginning in the posterior lateral corner and radiating to the anterior axillary line. It is usually exacerbated by sneezing, coughing, deep breathing, change in position, and quick motions. Disclaimer alert. This is an informative video for athletes and non-athletes so that they can learn exactly what a upper body or rib stress fracture feels like. Please see a medical professional if you think you have a stress fracture. Watching this video does not take the place of seeing a medical professional. Always remember, prevention is easier, faster, and less expensive than rehabilitation. So you want to formulate a good training routine that gives you adequate rest between training sessions. Never perform an exercise that elicits or intensifies symptoms, and always perform all exercises through a symptom-free range of motion. If a stress fracture is diagnosed, you should cease all activities until comfortable with the activities of daily living. This generally takes 5 to 7 days. Avoid all causative activities and begin non-impact cross-training to maintain fitness. As the fracture heals and symptoms lessen, training in sport may begin at a very low intensity and progress gradually. A stress fracture is a very frustrating injury. So do yourself a big favor and develop a training program that allows you to avoid a stress fracture. So you want to have built-in rest and recovery days, and you want to make sure that your training volume and intensity increases in small, gradual, calculated increments. Make sure that you are consuming enough healthy calories, protein, fats, and carbohydrates, and you want to make sure that your vitamin D levels are more than sufficient. You can get vitamin D from going out in the sun during non-peak hours, and you can also supplement your nutrition with vitamin D. I did a video on vitamin D and bone health, so I am going to put a link to that video in the comment section below. This will help you to watch that video and learn more about what you can do to help to strengthen your bones and make sure you have a sufficient amount of vitamin D. In your training program, you want to eliminate all strength imbalances. Usually with the shoulder, there is a strength imbalance between the anterior shoulder muscles and the posterior shoulder muscles. So you want to stretch the anterior shoulder muscles. This includes the pectoralis major, the pectoralis minor, the serratus anterior, even the latissimus dorsi, and the teres major muscles. And you want to strengthen the scapular retractor muscles, which are the rhomboid minor, the rhomboid major, the middle trapezius, and the lower trapezius. You also want to strengthen the posterior rotator cuff muscles, which are the supraspinatus, infraspinatus, and teres minor. And you want to strengthen the posterior head of the deltoid. This will help to stabilize the scapula, and this will help to build proportional strength in the shoulder complex. If you are a rower, a baseball player, especially a baseball pitcher or a golfer, please work with a certified fitness trainer or a certified strength and conditioning specialist, or you can also work with one of your coaches to develop a treatment plan that will give you sufficient rest between training sessions and increase your training volume and intensity in small, gradual, calculated increments to help you to prevent a rib stress fracture. Thank you everybody for watching today's episode of Dr. Ozello Sports Medicine Report, where I covered upper body, specifically rib stress fractures. This is a painful and performance limiting and frustrating injury. So do yourself a big favor and prevent this injury. And if you do acquire this injury, rehabilitate completely. Give yourself plenty of rest and then build back up your training in small, gradual, calculated increments. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. You can visit my website, championshipchiropractic.com, where you can find more information on the book, and you can also find my blog. My blog contains articles on spine health, sports medicine, chiropractic care, health, fitness, and nutrition. Always remember to train hard, but train smart. Get adequate rest between training sessions. Utilize nutritional and supplementation strategies that work for you. Prevent injuries, rehabilitate injuries, and accomplish your goals. Please feel free to like this video. If you have questions, feedback, or suggestions, please leave them in the comment section below, and please subscribe to my YouTube page. Thank you very much.